Hello and welcome to Meet the Press. Well, the federal government this week bought itself a fight with the country's doctors on a couple of fronts. Firstly, in trying to give consumers cheaper medicines, they're going to allow pharmacists to substitute generic products for more expensive brand name drugs. The doctors are threatening to veto the move. Why? Because they say the big brand name companies sink lots of money into research and they pay for the doctors' weekend seminars. Then there's the row with the surgeons as a result of the BOEM report. That report says surgeons deliberately keep their numbers low so that their incomes remain high. And the answer, according to the report, is to allow GPs and nurses to do the minor operations and administer anaesthetic. That way, waiting lists for elective surgery will soon disappear. Well, where does the opposition stand on these issues? Our guest today is the Coalition's Shadow Health Minister, Bronwen Bishop. And joining me for the interview, Lenore Taylor from The Australian and Malcolm Farr from the Telegraph Mirror. Good morning, Bronwen Bishop.
Good morning, Barry.
We'll start on the more general health issues. The Coalition now pledges to retain Medicare and bulk billing.
That's correct. Universal bulk billing, unchanged, will remain. The other strand of our announced policy is that we will have tax relief for premiums paid for private health insurance. Yes,
we'll get to that in a moment. Now, on the question of co-payments, there was a report overnight that the opposition will entertain the idea of co-payments.
I'm afraid that headline was a Richardson, i.e. untrue. The fact of the matter is that we are committed to keeping universal bulk billing unchanged, and the reason's very simple. The Australian people have decided that's a fair and equitable way of providing access to medical treatment. This is a democracy. When the people speak, you listen.
So this is a more pragmatic approach now on the part of the Coalition in the formulation of health policy in particular.
It's the correct approach, and it's the one that the people respond to.
Well, if you round up any number of people, I'm sure they'd also say they don't want to pay an increased Medicare levy. So would the opposition also listen to the people and pledge not to increase the levy?
Glad you raised the Medicare levy, because it, in fact, is irrelevant to the entire debate. That is just part of the general taxation revenue you and I pay. It pays for around 7% of our total health care bill, and yet the mythology is it pays for it all. The figures are these. Total cost of health care, $34 billion. Commonwealth government provides $15 billion. State governments provide $8 billion. Private sector provides $11 billion.
So
Medicare levy, $2.4 billion.
Mm-hmm. So where does the money come from then for your promised tax incentives? It's a fairly big ticket item.
Yes, there are 2 points to be made there. The first is that with the dramatic decline in private health insurance, the government we got here and now is facing a crisis in funding. For every 1% of people who leave private health insurance, the government has to find another $100 million. Not after the election, not in 6 months, but now. And I continue to ask the government, where are you getting the money from? Are you going to let the budget deficit blow out, or are you going to raise general taxation revenue?
Well, they say, where are you going to get the money from? For this,
I'm not the government, or hadn't you noticed?
No, but you want to be. So where would you get the money?
Precisely. Now, the point is you can't afford not to do it, because the cost to the system at the moment, with the government's success of the government's policy to drive people out of private health insurance, means the government is in crisis now.
But these tax breaks cost money. Where's the money coming from?
At the time of the election, the breakdown in where our policy, the costing of our policies will be released. And let me tell you why it will be done then. For many years I've sat on the estimates committees, and I've asked questions of public servants who have been put in the most impossible position by government, who abuses them and makes them do party political work. Again and again I've seen Treasury and Finance forced to set up political units to serve the political party purposes of the government of the day. I will not aid and abet that process.
But will it come from within the health portfolio? Will you have to find the money for the tax incentives from within your existing health budget?
Those questions will come to you, will all be answered for you when the details of that policy are announced at the time of the election is called. Now, let me ask you this. You're also concerned about policy. How is it that you do not put scrutiny on the government? Why aren't you asking where are they finding the money to pay for the health crisis?
Well, we've got you here today to ask questions too. And I mean,
Lenore, let me say I suggested that Carmen Lawrence should come here and debate it today, because she won't debate me in the Parliament. She won't debate me at conferences. She runs a mile. So I thought you might be able to get her on. Then you could ask her.
Well, let's pretend I'm Carmen Lawrence just for the moment.
A bit hard, Malcolm.
Where would cuts be made within the health portfolio to help justify the tax relief that you want to offer?
As I've told you, Malcolm, those details will be announced. But the important thing is this. Unless we stem the tide of the flow of private health insurance losses, then the crisis will worsen. You can't afford not to do something about it. Now, the Australian people have said again and again that they believe that tax relief is fair and equitable. And as I said, in a democracy, you hear what the people say.
OK, we have to take a break at this point, but when we come back, we'll look at the BOEM report into Australia's surgeons.